Hello, hi. This is Dr. Erica. Thank you for joining me on this particular video. I am just going to do a brief product overview for influenza A and influenza B prophylaxis and treatment. I know influenza season is now coming to a close, and we're now expecting allergy season. We're expecting vacationing, meds for traveling, things like that to come out. But I do want to do an overview of oseltamivir, also known as TAMIFLU, which is available for prescription purposes only, and it's indicated for those who are 1 years of age up until adulthood. And it is weight basing, so the dose that is prescribed is going to be weight based dosing, pretty much, and it is expected to work for about 5 days to about 7 days, depending on if it's for treatment or for prevention. So I'm more so seeing Tamiflu being dispensed for treatment purposes rather than for prevention purposes, mainly in those who are young, some adults as well. And I've been told that it is effective, and so that's why we continue to dispense it. Some say it's not effective, some say it is effective, but I still see it being dispensed in retail pharmacy. I do want to go over it briefly. It's not a large class of medications, so it's only maybe one or two drugs in this particular class, and that one that sells all the time in retail is going to be the Tamiflu. Tamiflu comes in capsule form, and it comes in a powder for reconstitution, and it is flavored like a fruity tooty flavor for those pediatric patients who need just a better tasting on the palate for consumption. Now, it comes in 12 milligrams per milliliter, and for adults, the dosing is going to be 75 milligrams twice a day for 5 consecutive days in treatment. Now, for kids, it might be a little less than that, depending on the weight of the child. For someone who's about 1 years of age, it could be 30 milligrams twice a day for 5 consecutive days. It's used for the treatment of uncomplicated acute illnesses due to, again, the influenza, and is used for prophylaxis, which is going to be for 7 days instead of the 5 days. Okay, it's an antiviral because it's going to fight against the flu virus. And I know that, again, flu season is wrapping up. No one is really getting immunized at this particular time of the year. Influenza is very prominent around August, September to about February, uh, mid-February or so. So the next go round for immunizations will be again in August, when patients are able to actually get the vaccine against the influenza and receive the vaccine at that starting at that particular time and point. Also, side effects. I want to mention side effects if I can. Side effects may be anaphylaxis or allergic reaction. If that occurs, stop the medication and let the doctor know so they can make adjustments to the dosing or make some adjustments with another medication. Okay, also, patients may experience nausea and vomiting. Those are some of the serious side effects that are more common. Again, nausea and vomiting, and it's most effective when started 2 days um, around the onset of symptoms. So if a patient is feeling symptomatic, then within 2 days, it's going to work more effectively during that time period. Also, it's best to store the reconstituted powder, the liquid suspension, under refrigeration, under cool temperatures. So do remember that as well. Okay, it works. Its mechanism of action, for those medical students who may be watching, for those pharmacy students who may be watching, in clinical services, its mechanism of action, I'll go over that real quick, is to following oral administration. Okay, it's going to be due to an inhibition of the influenza virus, neuraminidase, and possibly through alteration of the virus particle aggregation and release. Okay, so it's mainly going to work against proteins, viral proteins. Okay, so if the virus cannot produce protein, then of course the virus cannot formulate, it cannot grow, it has to disintegrate and eradicate at that particular point. Okay, the majority of the drug is eliminated in the urine, so those patients who may be dealing with renal dysfunctioning, they may have to adjust therapy at if that's a concern. Okay, so make note about that. Drug interactions, there's 0 to none, so that is pretty good. And I would definitely recommend Tamiflu for those patients who are symptomatic and want to go ahead and get rid of those symptoms within 1 or 2 days of symptoms. So I would definitely suggest this particular product. So I do recommend it and hope that patients do consider letting the doctors know. Now, as far as cost, it's not very economically efficient, just because this medication is more so a medication for those patients who did not get their flu shot, patients who did not go ahead and get that early injection. It's mainly for those patients um, who got the flu symptoms from a relative or someone who lives in close proximity, someone who may have been contagious and have spread it, and that way that person is now feeling symptomatic. So because there's preventative measures such as the influenza shot and also cold and flu medications that are over the counter to help prevent symptoms and so forth, most most pharmaceutical insurances will not cover for this medication. Now, if you have commercial insurance, then yes, you may have that coverage through your employer, so forth. However, if you're not covered by a commercial insurance and you only have like Medicaid, or if you only have government type insurance, then yes, you may come into a situation where this particular medication will have to be paid out of pocket. Now, the out of pocket costs can be expensive. I'll let you know about that, in the 100s of dollars for someone who might not be able to afford that particular medication. Then there might be an alternative. So check with your doctor, your pharmacist. But again, it's not usually covered by insurance companies just because there are other preventative measures in place before the onset of becoming contagious from others. So do be aware of that. Um, I am a healthcare provider, a pharmacist who definitely chooses to prevent rather than to treat, because treatment comes with um, other forms of not pricing and other red tapes and things like that. So I'm definitely a person that likes to prevent instead. So do be aware of the complications when receiving treatments, when there's adequate prophylaxis or adequate prevention measures that are known and researched and in place. So I do advocate for immunizations, again, starting in August, September for the influenza shot. So if there's any questions or comments, please let me know. I'm Dr. Erica, a pharmacist. Thank you for joining me on this particular video chat. I hope to see you on the next one. Please subscribe to this channel.